I just wanted to ask you a couple of questions about a few things that you see commonly. Let's start with Charlie, because he's my cat, and Charlie is recently had a lot of weight loss, and he's now looking slim, taut and terrific, but he started coughing, as you know. And when he was presented to you, he'd been coughing for a couple of weeks. So how did you go about working up him as a coughing cat? What did you have to do?
Yeah, well, the first thing we do with a coughing cat is obviously listen to their chest and see how they sound. Are the lung sounds increased? Are they decreased? We look at the way they're breathing. Is there increased effort with how they're breathing? Is there have they got short, shallow respiratory rate? And how does their heart sound? Is there an arrhythmia? Is there a gallop rhythm? We'll look at their gum colour. Sometimes if they're not aerating properly, they may look have a little bluish tinge there to their gums. And then the next step is generally take a chest X-ray, so we can get a good look at their lungs. Most of the time, we've got a fair idea whether it's going to be a cardiac disease or whether it's going to be lung disease. In cats, it's nearly always lung disease. They don't tend to cough like dogs do with cardiac disease.
Okay.
So we did a chest X-ray with Charlie.
Right. And what did you see on the chest X-ray?
So on his chest X-ray, he had a pretty spectacular diffuse bronchial pattern.
Right.
And that's pretty characteristic for cats with asthma. So when we see that, we can go ahead and then do some other tests like a bronchial wash or a tracheal wash in the cats and get a sample of the cells that are in those airways and then look at them. And typically for cats with asthma, they'll have a high eosinophil count in them, so the sort of cell we see with the allergies. And then we go ahead and we treat them with anti-inflammatory drugs.
Okay, so we put Charlie on some antibiotics as well as the anti-inflammatory because we didn't do a wash, is that right?
Yeah, pretty much.
Weren't 100% sure.
Yeah, I mean, cats can get mycoplasmal infections, so we'll often cover for that. And the drug he's on often has anti-inflammatory effects as well, so there can be a double benefit there, but generally just to cover mycoplasmal infections.
So he's looking really good now, he's not coughing. What sort of things might have caused him to have asthma?
Yeah, so this is where we go back and we look at the home environment. So, I asked you questions about anyone smoking in the house, using any deodorising powders on the carpets, people that use talcum powder, some of those sprays, deodorising sprays, strong cleaning products in the bathroom, things like that that he might inhale that would irritate his airways. Yeah.
Right, and is it something that's likely to recur once he comes off medication?
It can do. I certainly recall a cat that used to come in every Saturday night with an acute asthma attack because the owner would be getting dressed and she'd be spraying perfume around that time, and it took us a while to work out that's what was triggering it. So sometimes there are obvious triggers. If you can remove the trigger from the environment, then it might not come back.
Right.
But if that trigger's still there, if this cat's reacting to dust mites or something like that, something that we can't take out of the environment, then it may well come back. Yeah.
Well, thank you very much for helping me with Charlie. He's a much happier cat.
Yeah, no problem.
Thank you.
Thanks.